My name is Simon. My friend Jake and I will talk about healthcare barriers for Hispanics as well as how to overcome them.
Some barriers include economic, cross-cultural, communication issues, cultural and ethnic beliefs, language barriers, and disparities in different Hispanic hinder the ability to accept healthcare.
An example of an economic barrier that Hispanics may have a hard time finding a job due to the language barrier. Also, some jobs may be racist or not hire them due to their heritage. This lack of being able to work in high and even some low-paying jobs results in low-income jobs being taken by Hispanics.
As a result, Hispanics cannot afford proper health care to see a doctor when sick. Hispanics may go to a walk-in clinic that is much more affordable than a standard doctor.
One way around this barrier could be to either hire a translator or learn English.
If Hispanics were to do this, it would take away the language barrier in the workplace, thus giving Hispanics a better chance of getting a better paying job and service.
Cultural barriers could be that Hispanics may be afraid of getting deported or may be unaware of their symptoms. They may also be unaware of the U.S. healthcare system due to lack of education.
One way to overcome this would be if Hispanics came to America and get their citizenship to take a mandatory class on how to integrate into this country more effectively. Interpreters may be needed in the workplace to help communication between doctors and patients. The requirements for certification to become a medical interpreter include having a GED or a high school diploma equivalent, be at least 18 years old, and complete a 40 hours of training either through an academic or non-academic program.
They would also have to possess linguistic proficiency in English and the primary language which one is seeking certification for. One way around this barrier would be if hospitals hired these translators to maximize service and better understanding for patient needs.
Hispanics have higher rates of obesity than non-Hispanic whites. There are also disparities among Hispanic subgroups.
For instance, while the rate of low birth weight is lower for the Hispanic population in comparison to non-Hispanic whites, Puerto Ricans have a low birth weight rate that is almost twice that of non-Hispanic whites.
Also, Puerto Ricans suffer disproportionately from asthma, HIV, AIDS, and infant mortality. At the same time, Mexican Americans suffer disproportionately from diabetes.
To get around this barrier, doctors should have a basic understanding of these differences and be able to identify them in any situation. So in conclusion, we have talked about the barriers that may affect Hispanics at a cultural disadvantage. Some of these barriers included economics, cultural, ethnic beliefs, traditions, and the language barrier.
We've also talked about the possible solutions of eliminating these barriers. To empower the healthcare system and Hispanic population of Americans, not only help one group of people, but make the country as a whole stronger.
Thank you for watching our video.